Hello friends, some one-liners for NEET PG Microbiology. Best method for serum sterilization is filtration. Heating at 63 degrees Celsius for 30 minutes does not kill. This is pasteurization. Pasteurization is ineffective for Coxiella burnetii, prions and spores. Tyndallization is a type of intermittent sterilization. Then the next question is Brown's tube used for indicator efficiency of heat sterilization. Brown's tube is used for indicator of efficiency of heat sterilization. What is a Brown's indicator? Brown's indicator is a small glass tube containing a red heat sensitive dye used as a chemical indicator for sterilization. The dye changes the color to green color after a defined period of time at a certain temperature. It is invented by Albert Brown Limited in 1930. Which of the following is used to test the efficacy of sterilization in autoclave? Autoclave efficacy is by Bacillus steatothermophilus, whereas hot air oven we can test by Clostridium tetani. Spores of which bacteria is used as sterilization control of plasma sterilization? For plasma sterilization, we use Bacillus steatothermophilus. The condition required for autoclave is autoclave requires 121 degrees Celsius for 15 minutes. Then this question has been lost, but the question is about disinfectant. All are true except. So what is the false statement in this question? Hypochlorite is virucidal. Hypochlorite is virucidal. True. Glutaraldehyde is poricidal. Yes, that is the reason why we use it in endoscopes and others. Phenol can act in the presence of organic material. Yes, it can act in the presence of organic material. That is the reason we compare any disinfectant with the help of phenol. Then ethanol cannot kill mycobacteria. No, ethanol can kill mycobacteria. Then sterilization. Sterilization of a fiber optic is done by glutaraldehyde. Next question. Which is false about Spaulding's classification? See, Spaulding's classification divides them into critical, non-critical, semi-critical and critical devices. So first A option, non-critical item is included in classification. True. Semi-critical item contacts with mucous membrane. True. Semi-critical item needs low-level disinfectant. Not low-level, it should require at least medium-level disinfectant. Cardiac catheter is an example of critical items. Yes, anything which comes in contact with broken skin or inside the skin, that is critical item. Which of the following statement regarding the disinfection is not true? So false statement. Statement 1. Hypochlorites are bactericidal and inactivated by organic matter. So first question, hypochlorites are bactericidal and inactivated by organic matter. True. Glutaraldehyde is sporicidal. True. Not inactivated by organic matter. Yes, that is the reason why we can use it in different, for sterilization of endoscopes and other things. Formaldehyde is bactericidal, sporicidal and virucidal. True. That is the reason why we use it in all. Formaldehyde is used in OT sterilization, OT fumigation. Then phenol is bactericidal and readily inactivated by organic matter. False. It is bactericidal, true, but it is not inactivated by organic matter. Right. Then The next, so all this is not necessary. Next, phenol coefficient indicates. Phenol coefficient indicates the efficiency of disinfectant. It indicates the efficiency of disinfectant. What is phenol coefficient? That is Reader-Walker test, where we will take the, in Reader-Walker test, we will compare the concentration, we will compare the dilution of disinfectant which is used to kill the suspension of staphylococcal with the same dilution of phenol which is used to kill the same suspension at the same time. That is phenol coefficient or Reader-Walker test. We will compare the disinfectant with phenol. Which of the following works by plasma membrane damage? Phenol works by plasma membrane damage. Then this question, what is phenolic disinfectants? Phenolic disinfectants include all of the following, which is Dettol, Cresol, Lysol, carbolic acid, Savlon, hexachlorophene. All these are phenolic disinfectants. Then the operating temperature in an ethylene oxide sterilization during warm cycle is 49 to 63 degrees Celsius. 49 to 63 degrees Celsius. Then, which of the following is a form of cold sterilization? Cold sterilization includes the ionizing radiations like gamma rays and beta rays. Heat labile instruments for use in surgical procedures can be sterilized by ethylene oxide gas. Ethylene oxide gas is a sporicidal and low temperature is maintained, and this can sterilize the instruments which are heat labile. Then, chest physician performs bronchoscopy in a procedure room of OPD. To make the instrument safe for use in the next patient, the most appropriate method to disinfect the endoscope is by endoscope disinfection is by 2% glutaraldehyde solution for 20 minutes. Which of the following are used for sterilization of surgical instrument? For sterilization of surgical instrument, we use autoclaving, glutaraldehyde, and hot air oven is used for surgical instrument sterilization. Ethylene oxide are used for the sterilization of heat labile materials or instruments, heat labile instruments. Then, all of the following are used to check the efficiency of disinfectant except efficiency of disinfectant is checked by Chick-Martin test, Riedel-Walker test, and Kelsley-Sykes test. Hugh-Gilfillan's test is used to differentiate micrococci from staphylococci. Then, hospital waste management. A known HIV positive patient is admitted in an isolated ward after an abdominal surgery following an accident. The resident doctor who changed his dressing the next day found it to be soaked in the blood. Which of the following would be the right method of choice for discarding the dressing? Okay, this is a HIV positive patient with blood, material soaked with blood. So as a result, we will have to put the dressing in an appropriate bag and we should send it for incineration to prevent its spread in the community. Then the next question is, all of the following categories of bio-waste management can be disposed by incineration except category 4. Category 4 includes chemical wastes which involves deep dumping or gas shredding, all those. Then the next question, third, agar count. In nutrient agar, the agar concentration is 2%. Next, fourth, Robert Koch's assistant has advised him to use agar instead of gelatin because the gelatin melts at 25 degrees Celsius, which is room temperature, whereas agar melts at 42 degrees Celsius. So in room temperature, that is 25 degrees Celsius, this agar is present as solid state, so it is easier for us to cultivate bacteria in it. Then Robert Koch cooked meat broth is an example of anaerobic media. Blood agar is an example of, obviously we added blood to the agar, so it is an enriched medium. Enrichment medium, if you see, that is a liquid medium. If we add some substances which will enhance the growth of bacteria in a liquid medium, then that is enrichment medium. Then which of the following statement is true? Agar has nutritional properties. No, agar does not have any nutritional property. We will have to add the things to the agar to have the nutritional property. Like if we add some nutrients like peptone water and other extract to the other agar, then that becomes nutrient agar. If we add blood to the agar, then it becomes blood agar. Chocolate medium is a selective medium. No, option B, chocolate medium is not a selective medium, it is an enriched medium. Then C, addition of selective substances in a solid medium is an enrichment medium. Not in solid medium, it is addition of certain substances in liquid medium is enrichment medium. Nutrient broth is a basal medium. True, nutrient broth is a basal medium. So last question of this class, in blood culture the ratio of blood to reagent is 1:5. Okay, thank you for watching.